So it says, thank you to our panelists for sharing your experiences. Is there any research that explores what specific aspects of transplant care may likely to cause trauma for patients and their families? I can read the question if you'd like. So Patricia is wondering, is there any research that explores what specific aspects of transplant care that may be likely to cause trauma for patients and their families? So, I mean, for me, as one of the liver transplant specialists, I can't think of any specific area that hasn't been addressed. I know that the mental health piece has been explored preliminary in the literature, and I think over the last several years that's sort of been brought up. The other aspect of liver transplantation has also been sort of my understanding is more so like inpatient hospital admissions and the frequency of inpatient hospitalizations and that effect on sort of mental health and like missing school and not being able to sort of reach the same achievement as some of their peers. So I know that that's been also discussed in the literature. And then as Dr. Frederick had mentioned, we know that not specifically for exercise tolerance, but for children undergoing liver transplantation, they're perceived to have more physical limitations than patients or control patients or normal healthy children. So from a liver transplant, those things have been highlighted for us. I don't know if any other panelists have any other thoughts on that.
I would say to Patricia's question, I think part of it, and I heard it from Dennis and Lindsay as well, is probably not recognizing just how much of the trauma is going on before we ever got here to a hospital setting. We've done it to ourselves. We didn't understand words. We didn't understand whatever it is. But I think there's that other recognition of how do you prepare for something that you don't want to come here for.
Yeah, I don't know that I have a lot to add. It's other than to say that I would imagine it's pretty hard to pinpoint down what specific areas, because it would probably vary across different families and across circumstances. For example, if a child required a lengthy hospitalization, every transplant is different. And so I think perhaps more importantly would be a need for more qualitative research in this area and then driving improved mental health resources for patients and their families both before and after transplantation.
So there is a large body of research looking at PTSD amongst caregivers, in particular mothers, following transplant recipients. I agree with you, there's a qualitative, actually exploring this experience in more depth. Some practitioners are now looking at PTSD amongst pediatric recipients. And there also is a growing body of literature also looking at post-traumatic growth. So also kind of more strength-based approach and some of the impact of patients and families.
Thank you. I think there's a question here. I just wanted to thank you all for really sharing your experiences. I'm going to take our kidney transplant, children living with a kidney transplant. The mental health piece is something that we struggle immensely with, and I think there's a couple of things that are true. One is that the people who are at the transplant centers, the clinicians now, I think we actually mostly now do recognize that this is an issue. We are trying to intervene earlier. Many of our mental health providers are making heroic efforts to provide help, but there's just not enough of them to actually deliver the care that they need. So that's the number one. Number two, all of us are operating in silos. We're not sharing our experiences within types of meetings like this, but not in a coordinated way. And in order to deliver this care, really we need to be using remote type of programs that don't require somebody physically to come to the center. And this speaks to a lot of people who live in remote areas with different groups that may be disproportionately disadvantaged by geography as well. And it just strikes me that we have a lot of the answers. You guys have all come up with these are some of the things that we should be doing. And I'm just surprised we don't have a national strategy yet, or that have come together on a national strategy for what are the resources we need. Because when I go to my program managers and they say to me, well, what's the standard of care? I have to look at them with a blank stare and say, well, we really don't know what the standard of care is because nobody's actually designed that standard of care. And wouldn't it be great if really smart people like you who have that lived experience could help us actually define what actually is the standard of care, and that we could actually use that type of an approach to say, I could talk to Janelle and say, actually, there's a Canadian standard that's been developed, and this is what it is. It includes these types of healthcare providers, and this is how we would implement that kind of a program. So I'm curious to hear what you think, because I think I hear a lot of us doing things at each of our own centers, which is great, but it's like N of 30, N of 50, and there's like an N of like 400 in Canada. And we really should be thinking at a national level, not at a local level.
Anybody want to respond to that?
I was just gonna say, I think that it would really bridge the gap between, the lived experience and the actual medical systems. Have a universal, way like that. Would be important. I think for me, when I was going through the process of having transplantation and everything, it was a huge thing that how I felt in my feelings and everything. And when I experienced to my parents, they were really, really into pushing into accepting, okay, yeah, you're going to feel this way, you're going to be feeling a bit sick, you're going to be screaming and everything. I think that from my parents and everything, my perspective was always like, I need to be strong. I need to make sure that I'm doing this, making sure that I'm going to be holding that gap, that I'm going to be responsible with this organ, with this transplant, because it's a huge thing. And my parents teach me a lot about taking care of my health and also making sure that for my my mental health and everything, it's making sure that yes, I have this problem, and yes, I'm sick. Yes, I have this, and I think that that shouldn't prevent me from doing multiple things during my daily life. I would have had my kidney disease when I was 10 years old, and when I went through that process, it was always like, I'm going to be sick, I'm going to be sick. But the friends were always like, no, you're going to get better, you're going to get better, you're going to keep doing it. Because when you do this, you're going to keep passing through that moment. And when it doesn't come over, when there's those big gaps where it's like the end of the world for me, I think it's mostly it's taking, okay, this is a big step, and I think you should take care of like, yes, this is just part of like that you need to take care of. And I think you learn from that into becoming more strong.
I think that CDTRP has been outstanding at removing some of those silos. Many of us are conducting studies across Canada, multi-site, multi-organ. I think one of the issues comes is that you have large grants to actually conduct the research, but then how do you implement those interventions in the practice? So looking at scalability and sustainability. And I think you champion that each of those pediatric centers advocate what the strategic priorities of those organizations, what funding is available from the perspective. That's the next hurdle we're facing beyond kind of the research level, reality of the practice.
I was just going to say exactly what you said, Tom, which is I think a lot of the answers are probably known. I think you know when you talk to a David or his colleagues, or you talk to psychologists that are supporting us, they would all say there's an ideal they couldn't possibly reach, and I think it's a matter of starting to document that with perspectives like these, but also with the people who know what they can and should be doing within their scope of practice and just can't because they're one person supporting an entire transplant team. And you know, and ever growing patient list as well. So I think it would be great to see a leading practice or whatever the right mechanism is for setting what should a minimum standard be in, you know, pre-post transplant care in the mental health, social work, or psychology realm.
Thank you. We probably have time for one more question.
So one of the things that was aroused was the lack of information or failure to understand the medical information. With electronic medical records now, lab test results are being released to patients almost in real time, letters, which I think is a good thing, the letters go to patients, but they're also in very medical language. I was wondering what your experience is receiving that information. Is it positive? Are there negatives to it?
I personally love it. I actually was on a call with Jenny just 2 weeks ago, talking about how to even continue to enhance that medical record even in the pharmacy world. So yeah, no, I'm a big proponent of having access to that data. I think for someone who hasn't had a 53-year kidney journey, I think there's probably a need for some orientation, because if you're just throwing a whole bunch more words that don't make sense, or acronyms, EGFRs, and those kinds of things, you know, you need to have some sort of baseline to know what you're even looking at, because you're now given information that you may not be able to act on.
I personally have chosen to actively not get it, knowing my personality. I'll just wait for my team to call me so I don't read into everything. So just knowing myself.
For me, I think the having speaker mentioning and everything, I think it's been really helpful. It lets you know that all my numbers are looking good, everything's going well, I think it's going with my daily life and everything. If there's certain numbers adequate, I'm not drinking enough water, things like that, I'm like, to watch it, to make sure that everything's going well.
I see that we have one more question. We'll do that before we go to break.
Thank you.
Sam, could you give us an example of sort of people using Voxy and maybe implementing now with liver transplant? What percentage, given the question about trauma, pain, sleep disturbances or quality of life, could you give us a proportion that from the transplant recipients that filled out those Voxy forms, did you look at the number and the proportion and how it so that we could sort of think through Tom's question of how do we address, what's needed? And if you can talk about how you use that, the prompts to actually enable that.
Sure. So most of the prompts that we right now are on mental health. We have specifically asked, I know the prompts program is acting at PTSD. And overall patients have been doing quite well, but we haven't been collecting proxy reports yet. And I do think most of those patients who are not transplanted at a very young age, you don't see some of those mental health issues in the adolescents, starting around age 12. I think if we're actually collecting prompts from parents, you would see a lot of that. I know there's parents that have been 18 years post-transplant that still have PTSD and are still living with that. Most of them feel quite isolated from the mental health support that are available at the time of inpatient hospitalization. They go back to their local communities. So we have put some interventions in place around virtual care and parent supports. But one of the things with the electronic health record that's tricky for youth is that accessing those portals is a parent accessing the patient portal or the patient themselves going in. So many patients have said they're quite reluctant to be able to provide out about mental health and have access to their portal. So I know right now we're actually hiding some of the mental health questionnaires for confidentiality reasons, for questions of sexuality or self-harm or substance use. Again, just thinking of confidentiality and emerging transition and independence.
Thank you so much to our presenters. Thank you to our panel. Thank you to the audience, both in person and online. We'll close the session now and have our last break for the day, and please be back at 2:30.